So moving on, we have this intervertebral discs. This is a soft gel-like portion which is present in between the bony architecture. Now it has its specific functions, why basically they are present in between the bony architecture. They're basically providing the space for the movements that it can take place between the different intervertebral joints. So this is the basic mechanism that it is basically going to carry out in the intervertebral discs and the movements that take place at the intervertebral discs. Now, from a superior view, when we look at the intervertebral discs, you can see that this is basically dividing into two regions out there. First of all, we have the annulus fibrosus, and then more centrally, we have the nucleus pulposus. Now, getting into the details of annulus fibrosus and nucleus pulposus, we must know that the shock absorbing effects are basically a part of the nucleus pulposus. So it's basically a more soft portion, and whenever there are some sort of decelerating movements or accelerating movements or any sort of jerky movements, then it is basically providing the shock absorbing properties are basically a part of this nucleus pulposus, which is placed more centrally in the intervertebral discs. Now, to provide a more fibrotic architecture to this intervertebral discs and to provide stability to the intervertebral discs, we have this annulus fibrosus, which is basically placed in it is basically a ring-like architecture and is providing the stability to the intervertebral discs. Now, what basically happens is usually whenever there is some sort of mechanical injury that takes place, there is this annulus fibrosus which provides stability to the intervertebral discs and to the length of the vertebral column. But of course, when there is a vicious mechanical injury or the mechanical force increases to a certain extent, there can be the cervical disc herniations, even it can lead to the thoracic disc herniations. Now, when we use the word disc herniations, it basically refers to the fact that this annulus fibrosus, it basically ruptures. And this basically leads to the nucleus pulposus to come out, and basically it can even damage the spinal nerves at that particular level. So this particular phenomena is known as the cervical disc herniation and is usually a part of the mechanical injuries that take place. And depending upon the set of the spinal nerves that they're going to damage, they're going to have that particular set of clinical signs and symptoms observed at that particular level. This is again a lateral view, which is emphasizing the fact that there is this intervertebral discs which is present in between the two vertebral bodies. So these are the two vertebrae. It can be any of the segments, either cervical, either thoracic or lumbar, and the intervertebral discs are present in between. This is the vertebral body, and this is the location of the intervertebral discs. This is the vertebral spine, and obviously the the spinal nerves, they almost come out of this particular area, and this is in close relation. So whenever there is a fracture due to any mechanical injury to these spines, it can even damage the spinal nerve, or even the herniations of the intervertebral discs, they can even damage the spinal nerves. So we went through the details of the intervertebral disc, and we just mentioned that the usual location is between the two vertebral bodies. The basic function is the shock absorbing properties that it has. And this is the normal soft organization of the intervertebral disc, showing the nucleus pulposus and the annulus fibrosus, which is basically a ring-like structure, which is providing stability to this softer shock-absorbing nucleus pulposus.